Okay, I'm gonna try to put the presentation. And okay, so today I was invited by Dr. Park. It's early in Mexico City. It's just about 8 a.m. and he asked me to present this topic. This is a very complex topic that I think I do every day, which is immediate implant placement. I work for a lot of doctors in the country, and I see a lot of cases when sometimes you have to choose the right implant, choose the right bone graft, and be ready to take any kind of decisions. So here we're going to talk about what can we do to enhance the success of implant dentistry, especially when we go the immediate way. Okay, so I think what we normally want to separate is what we do in the school and when we went to the postgrad program and what we do on the private practice, because most of what I do is now private practice. And the connection between these two parts is you have to really plan, do the treatment planning and decide, and always kind of talk to the patients on how are you going to decide to solve the case, because every case, it has its challenges and it can be solved in different ways. Okay, so I think what we have to, not us to see, but the patient to see is see the big picture, see how is it going to work. And because sometimes the patient want to go for the implants and the patient is motivated and ready, but the patient doesn't see the soft tissue that is missing. And sometimes the patient expectations are